After patients undergo colonoscopy, the automatic surveillance system analyzes patient data from the electronic health record system, updates the status to pending check, and allocates post-polypectomy patients into one of two groups: those with surveillance intervals that can be automatically determined, and those with surveillance intervals that need manual recommendation. In the list of patients pending checks, the table displays the examination ID, examination date, expected surveillance date, status, and other information. Physicians can click Detail to check detailed information for each patient and review the surveillance interval. The interface mainly consists of 5 parts: the surveillance interval, baseline information of the patient, endoscopic and pathological reports, endoscopic images, and previous colonoscopies. By clicking the question mark, physicians can review the surveillance guideline issued by medical associations for reference. For patients whose surveillance interval can be automatically determined, a surveillance interval assigned by the automatic surveillance system and keywords describing polyp properties will be highlighted. If physicians want to change the automatically assigned surveillance interval, they can choose a different interval or enter a custom interval by clicking Customize. After approving the automatically assigned surveillance interval or assigning a custom interval, physicians click Confirm to set the interval. Patients whose surveillance interval needs manual recommendation are further classified into 9 groups: no pathological result, poor bowel preparation, colorectal cancer or suspicious malignancy, surgery, or colorectal ESD history, cannot tolerate and stop early, without polyp lesions, hematoma or lymphoid polyps, inconsistency between endoscopic and pathological reports, and no polyp size or size without unit. For these patients, physicians can make recommendations by classification. Using poor bowel preparation as an example, physicians can choose this classification to display all patients in this category. Physicians can click Detail to determine the surveillance interval for each patient. Because these patients were allocated as needing manual recommendation, no interval is given and no keywords are highlighted. The physician should enter and confirm a surveillance interval. The status of patients who have their surveillance interval confirmed will change to pending surveillance. The automatic surveillance system is designed to automatically send a message and make a phone call to inform patients 1 week before the expected surveillance date. After patients are notified, their status changes to informed. For those who were not successfully sent a text message or did not answer the phone call, their status changes to notification failed to remind physicians to follow up. In summary, the automatic surveillance system can accurately identify different types of patients, assign appropriate surveillance intervals, and proactively follow up with patients. The system has great potential to improve physician and patient adherence to guidelines while relieving the workload of clinicians and nurses.